Dr. Yoni Witten here, and this week we're talking all about stem cells. Now, stem cells have been used widely throughout the world for almost 20 years. But for various legal, ethical, and financial reasons, the United States is trailing way behind the power curve, and they've only started to become a popular treatment option here in the States in the last few years. Now, with this recent emergence, there's a lot of misinformation circulating out there about what stem cells actually do. So this week, I sat down with Joshua Kettner, who founded a Center for Regenerative Medicine that uses stem cells extensively to treat a host of different conditions. And we separate what is fact and what is fiction when it comes to stem cells. Let's get into this. Welcome, everyone. Thank you so much for being here. We're very fortunate to have with us today Joshua Kettner. He is the unofficial spokesperson for stem cell treatments in Mexico, and he has an extensive background in regenerative medicine. Thank you so much for being here, Josh.
Oh, thanks for having me. Thank you so much.
So I wonder if we could just start off with a little bit about your background. I know that you've owned the Dream Body Clinic down there in Puerto Vallarta for the last 9 years. How did you get started with this?
Well, almost on accident in a way. I moved down here 12 years ago. I actually came down to get into more assisted living, caregiving, a few gaps in that system that, I think could be fixed. So overregulation and such, and ended up coming here because of that. And just investors fell through, ended up meeting a doc who'd been doing, it's more of like a fly-in-by program for different medications, a lot of like growth hormone and hormone therapies. And he went back to the States for a PhD program. I kind of took over at that point and hired some doctors to help out with that. And we did that for the first few years. And then about 5 years ago, we got into stem cell therapy. And we got into that because my dad, he had Lou Gehrig's disease. That's a big part of how I got into caregiving and all of that. And knew a bit about stem cells and what was going on back then. Things, the embryonic stem cells, especially back then, just weren't working. They're typically turned into tumors, and just saw that, kept an eye on what was going on with that. And little over 5 years ago, kind of started researching what was available here in Mexico and managed to find some incredible stuff. And we started working with these labs to offer this to, primarily Americans and Canadians, and, people from Europe. That's kind of our main, demographic.
Very interesting. And I want to start at the ground floor with you, Josh, because the United States lags behind the rest of the world when it comes to stem cell treatments. They're just now kind of peeling back the veil and showing people what's been available to people in other countries in Europe. And I know South America and Central America are way ahead of the United States on this. Why is it that the rest of the world is so far ahead of the US when it comes to stem cells?
It's pretty basic. It's just the cultivation aspect.
Okay.
For whatever reason, they will not allow the cultivation of the cells. Like, you can go get fat-derived, bone marrow-derived stem cells. You can even get placenta or umbilical based, like what we use from, I think it's Utah Cord Lab, but they have to use the whole umbilical cord because they can't expand. And the expansion is where you get the most cells, because it's exponentially, like 2, 4, 8, 16. You're able to get billions of cells in a day, and it becomes a numbers game. That's really what it is. There's some incredible stuff. A lot of the top research for stem cells is coming out of the US. It's just they're not allowing it to actually be used. And it's probably a lot to do with, the big pharma likes to, like to dish out pills. You got the orthopedic surgeons have a pretty big lobby in DC. They really don't like it because they like to cut. So there's things, mostly money in the way, I think, is probably the main thing.
And can you just go back a little bit and explain what expansion is?
Yeah, for sure. So when they take the cells to cultivate, meaning taking the cells, they isolate them from the source tissue primarily, and then they replicate those cells. So the initial round, it's a bit of a traumatic event. It's probably the best way to describe it. They are removed from that tissue, and the stem cells, mesenchymal stem cells like we use, their main thing is the paracrine effect. It's the signals they're sending out. They're more like the manager on the construction site. They
Okay.
really aren't turning into anything like that, like people think.
Okay.
And because of that, you need a lot of them. You need them guiding, and that's seems to be kind of the direction to go with it. So
That's incredibly interesting. So, and it's one of the reasons why I wanted to have you on, frankly, is because my understanding, going back to embryology back in school, is a stem cell is an undifferentiated cell that basically takes on the flavor of whatever the surrounding cells are. And
yeah.
so my understanding as an outsider looking in was, if you inject stem cells into cartilage, they become cartilage. Now you're saying with mesenchymal stem cells, that's not what's happening.
No, it's not what's happening exactly. So that's where it gets interesting. We went to a conference 2 years ago with Dr. Arnold Kaplan.
Okay.
He's a professor at Case Western. He named mesenchymal, or mesenchymal, however you want to say it, stem cells back in the early 90s. And at the conference we went to, the first thing he talked about, he goes, first, a mesenchymal stem cell is a mesenchymal stem cell. It doesn't really matter what tissue you get it from. They typically live on the capillaries. They're called pericytes, right? So they're wrapped around the capillary, look like little octopuses that come off. They look for inflammation. That's what they're attracted to. So in vitro, in vitro, they can be turned into cartilage. They can be turned into chondrocytes for cartilage, all kinds of different tissues, and that could be used. But the problem is then they have HLA markers of the donor host. When they're just put in, like in vivo, they don't differentiate. So like he wishes he could rename them messenger signaling cells instead of mesenchymal stem cells, because they're really not a stem cell once they're in your body. They're yeah. So it's not like the embryonic cells like people think. And the problem with embryonic has been that like they tend to turn into tumors. A good example is my dad. Like he had Lou Gehrig's, and one of the guys who worked for him, his uncle, had it too. This is 16 years ago. He went over to China. They cut open a section of skull, put in the embryonic stem cells, patched him up, and he came home. And for about 2 weeks, he was getting better. We're like, wow, this is a thing. This is it. He went from kind of slouching to walking upright. But then he just keeled over 2 weeks after, and that was it, because it turned into a massive brain tumor. Because
In 2 weeks.
typically, yeah, two weeks after he got back, so it was probably like a month after or so. But the problem is they want to become a baby. They want to keep replicating, becoming something, and they're finding new ways to do it. Like induced pluripotent stem cells are probably the way forward with that, where they can make very specific tissues and cells. So that probably will be the future of this. But for right now, mesenchymal stem cells for inflammation, for like guiding the healing, they pretty much allow your body to heal like it did when you were a little kid. That's probably the easiest way to explain it.
That's amazing. So what you just said is incredible. So that essentially there's an umbrella of stem cells, and there's two completely different animals in there.
Yeah.
There's the mesenchymal stems. Go ahead.
And you have hematopoietic stem cells, which are the stem cells in your bone marrow, which produce red and white blood cells. So there's a few different ones, and they're all called stem cells.
Yes.
And it's so confusing for people because they're totally different.
Yeah. So that's actually really important, because there's franchise organizations that have set up shop here in the United States. I know of one business in particular has clinics throughout San Diego and the Southwest, and they are definitely promoting the idea that we're injecting stem cells that will become whatever the damaged tissue is.
Oh, and that's actually one of the things Dr. Kaplan talked about. And if you look up, people can look up his videos on YouTube or anywhere else, and I link to some of them on my site, because that's at the conference we were at, he got really angry at a group from Texas that was doing bone marrow, because he goes, that's not a stem cell therapy. He goes, that's a cell therapy. He goes, when you're doing the fat derived, the bone marrow derived, they're basically extracting, that solution, like either fat or bone marrow, and then put it in a centrifuge, maybe put a little collagenase to separate the tissues so you don't have anything in there. It's just liquid. And then injecting it, in like less than maybe 1% of that solution is actually mesenchymal stem cells.
Wow.
So it's like what Coca-Cola does. It's like, hey, here's an apple juice, and then you read the label, 99% sugar and water, 1% apple juice. It's actually how he described it. So it's become a marketing game. And unfortunately, because people have these credentials and such and everything. People just kind of blindly trust, and they're like, oh, it's a stem cell therapy, and it's really not in a lot of cases. So you kind of need to know what's going in your body and how they're doing it, and that's
Yeah,
what we've been trying to do. Yeah.
So, what was the type of stem cells that your father had put into his skull?
It wasn't him. It was a friend of his, basically. But they were embryonic stem cells, like aborted fetuses,
Okay.
that they harvested in China, and they did some manipulation and whatnot. But we're essentially trying to get those to, I don't know what they wanted them to become. Just they assumed it would know what to become, and they didn't. And China's just as regulated, if not more, than the United States now. They've really cracked down on all that. You used to be able to go there for different treatments, and not so much anymore, from what patients have told me that have come from there.
Wow. So you guys are running an operation in Puerto Vallarta that uses
Correct.
exclusively mesenchymal stem cells?
Yeah, exactly. Ours are all from Wharton jelly and from placenta. That's where we derive them from.
And can you explain what the Wharton's jelly is?
Yes, it's just think of it as the inside of the umbilical cord.
Okay.
It's the right there. So that tissue, it's the youngest tissue. Again, it's not that like one's better than the other. I mean, you could take it from your own fat, you could take it from bone marrow. The advantage of Wharton jelly or placenta is that it's the youngest tissue. It hasn't been exposed to like the immune system, so it doesn't have any, if you have an autoimmune disease, for example, like we see a lot of MS patients, you don't want your own cells.
Okay.
And even Dr. Kaplan talks about this, because those cells, like, they're not working properly. They are already, trained to your immune system. So you want them from another source that's healthy, all of that. And mesenchymal stem cells are unique in that they lack HLA. So those would be the markers that would tell, your body to reject it, to kickstart the immune system to kick it out. So there's no risk of rejection, anything like that.
Nice.
And they essentially reprogram the immune system to work properly. They send out cytokines and chemokines that, think of it like antivirus software for your computer. It's programmed wrong. It's attacking something it should be protecting. It's reprogramming them to stop attacking. And we see tremendous success with autoimmune conditions because of that.
Wow, that's fascinating. So you're bypassing the possibility of a rejection altogether because there's been no exposure.
Yes, exactly. So there's no risk of that. They actually use it for graft versus host disease. They're finding it works very well for that. So
Amazing.
yeah.
Amazing. And a question, you're getting it from the Wharton's jelly, the inside of the umbilical cord, and from placental tissue. Are you testing or what type of testing is in place to ensure the health of the host?
Yes. So like, you got to meet Dr. Romo real quick before we got going. He's our head physician, but he's a gynecologist. His brother-in-law founded the lab, I think it was close to 16 years ago, same thing, gynecologist. He did his PhD thesis in this, figuring out all that. So the testing wise, the women need to be between 18 and 30 years old first. And it's just, women over 30 tend to have complications and whatnot. So we try to go closer to 18 if we can. Fortunately, there's a lot of babies in Mexico, so that's good. But we work with a fertility clinic, so they're pre-planned, healthy live births. They're all C-section because we don't want to damage any tissue. And even then, only 1 out of about every 100 is viable for us.
Wow.
The good part is that 1 can last us anywhere from like 4 to 6 months because we're expanding the cells. We really don't need a lot of tissue per time, which is great. So the women are gone. I'm doing some stem cells right now, actually.
Wow.
It's kind of funny, but turn that off.
You're doing an IV solution there.
Yeah, my mom's in town and she wanted some stem cells, so I did some with her, but sorry, I didn't get my timing too well.
that I have not heard as a bonding experience before. Very interesting.
But sorry, I'll get back to it. But yeah, the women are tested thoroughly for just about everything. That's just standard practice here in Mexico. A mesenchymal stem cell couldn't carry a virus. It has a less than 5% chance of carrying a retrovirus. So, 1 second. So this is actually on our site. People can see it too. We have a third-party lab that then the tissue is examined for everything, and then the isolated stem cells are checked, and we give everyone a certificate. It's from a third-party lab, so it's not us being like, hey, our cells are good. Like, it's we understand. We're in Mexico. People have this bad, kind of understanding, thinking, they just picture some dirty dump like in Tijuana or something, I think, when they think Mexico. If you came here to Puerto Vallarta, I mean, it's unreal. It looks like, we call it cheap Hawaii. It's very nice. It's really a lot of medical tourism here.
Yes.
But we have to do all that. So we check all the major retroviruses. We check, the CD markers to know that it is a mesenchymal stem cell. We go by the International Stem Cell Association's guidelines for that. We check for all the bacterias, mycoplasmas, bacterias, just yeast even. I mean, you get the whole thing. It even shows you the viability, cell count, everything, so that you know what you're getting, and that you don't have to risk any sort of infection or anything like that. And we've never had an issue with it.
That's fantastic. So the mesenchymal stem cells that you guys are using exclusively are coming from the Wharton's jelly and the placenta. I know that here in the States, there's restrictions on the type of stem cells that practitioners can and cannot use. And a lot of people are doing liposuction to pull stem cells from fat, or bone marrow aspirations.
Yeah.
What's the difference in the type of cells that they're getting from those two procedures?
So let's start with fat. So, for example, my sister-in-law is a doctor, actually, and when she was our first doctor when we got started, and I had her trained in Mexico City on the fat derived, because here we can do the liposuction, take the fat, and we can go a step further. There's actually an FDA device that you can take the stem cells, and it'll filter out everything but the stem cells, and then it cultures in this sort of tube device, right? And so since we're able to culture, it's basically just a waiting game at that point. And her patient was 35. It took 4 weeks for that liposuction stem cells to culture up to 10 million, because you're lucky if you get 100,000 stem cells from fat derived. And then bone marrow is even worse, because like I mentioned earlier, mesenchymal stem cells, they are called pericytes. They live on the capillaries. So that's why areas with blood vessels are the best sources. Well, there's no blood vessels in the bone marrow. There are stem cells there, but you've got mostly hematopoietic stem cells, which, they're creating red and white blood cells and whatnot, but not a lot of mesenchymal stem cells. So you're lucky if you get like 10,000 that way.
Wow.
And people are still seeing results sometimes, but more often than not, we're seeing people will do those and they don't get too much benefit, or maybe just a little bit. It's mainly inflammation, but not a lot of regeneration. So that's the main difference, is the expansion. It becomes a numbers game. It's not that one's, at least for like a joint, like a bad knee, it wouldn't matter if you took it from your own bone marrow or fat or umbilical, they're all going to work the same way. But I mean, we put 25 million in a knee, and up there, they're lucky if they're putting 100,000. So
wow.
It's just a big difference.
Yeah.
There is one lab, I think, out of Utah that is actually able to use umbilical, but they have to use a whole umbilical cord, and you're looking at like maybe 5 million cells. And even then, they then have to cryo-freeze them and ship them, and the thawing process tends to kill about 50% or more. And
wow.
it gets really expensive for a lot less cells. I mean, it's just what it is.
Wow. So the expansion is something that is extremely limited here in the States.
They can't do it. That's the problem. If they could expand the cells, I mean, they could do amazing stuff. I mean, you would think like doctors all around would be doing this for patients with injuries and whatnot, but the way it is, it seems like they really like to push the surgeries, the bigger ticket kind of items, and that's just kind of where it's at, because then insurance will typically cover it, and insurance won't cover, stem cells at this point, so it's very tough.
Wow. So it's kind of the status quo is a little bit ingrained right now. So being emerging technology is kind of a tough spot to be in.
Yeah, and it's weird because the argument will be from the FDA is that there's not enough research, but if you go on Google Scholar, you can find 100,000 or more like published studies into mesenchymal stem cells. I mean, they've been thoroughly vetted, they've been thoroughly examined. Like, it's pretty evident that they're safe. I just don't know why they aren't pushing it a little bit harder so that they can start doing more with it. And I think it's because you can't really patent something that, is naturally in your body. And that makes it tough to, control and make money off of. I mean, that seems to be why. I could be wrong, but that's kind of my take on it.
It's very interesting. I have a question for you from an ethical standpoint. If you guys said that you're harvesting approximately from 1 out of every 100 umbilical cord
Right.
placenta. If that tissue is not being used for stem cell harvest, what happens to that tissue?
So what we do is, at least with the placenta, we do keep and we lyophilize it. And anyone who does an IV with us, we actually reconstitute that with saline and we do subcutaneous injections. And it acts like a super vitamin shot. It's got every nutrient, mineral, vitamin you can think of. And it stays in your system. What slowly dissipates over about 3 months. And that 3 to 6 months is when we usually see the most results with what we're doing. So that's what we do. We try not to waste any tissue, but you got to think in a normal birth, it just gets thrown away anyway. So I guess it's not so much an ethical thing because it'd be thrown away anyway.
Yeah, that's kind of what I was wondering about. So now that we've established where they come from and the limitations and this phenomenon or the ability to expand upon what you're getting from the donor tissues, what are you guys using stem cells for down in Puerto Vallarta?
Yeah, so this morning, I'm kind of tired. I woke up at 5 and we had a patient. It's his second time here with autism. We took him to the hospital operating room, put him under, and we did an intrathecal injection of 50 million stem cells. And yeah, it's unreal the kind of results we're seeing with cognition and just improvement with that. I mean, it's not a cure or anything like that, but like these kids will have pretty normal lives from what we're seeing on the most part there. So that's one thing.
Wow.
Yeah, it's pretty cool to see.
So just to clarify for the people watching, intrathecal means that you're putting it into the sac around the spinal cord.
Correct. Yes.
The same way an epidural would be done, or are you doing it in the neck?
We do it around like L4, L5, or
So the
L5.
same as an epidural.
And yeah, it's a 30 gauge needle, so it's like an insulin, but needle, but it's real long. I've done it myself. Like I've done every treatment, just
Okay.
so people know. I don't just sit there and like talk about things. Like I've done every single one. So even I've done that one. It's kind of freaky thinking having that big a needle go in your back, but
And when you say you've done, you mean you've had it done to you.
to me, yes,
Okay.
exactly. Yeah. So I had that done about 2 months ago, and it's interesting, but it helps with brain. We're seeing some improvement with like Alzheimer's there. We're seeing MS. We're seeing incredible results, and especially since we added that last year, the intrathecal, we're seeing brain lesions heal. We're seeing the autoimmune factor just go away. It stops attacking the brain and spinal column. It's really incredible.
So you
So we're
guys actually
seeing,
have before and after scans on people with MS showing healing of
yeah.
the.
And I've got them posted right there on the website. If you go and take a look, you can
I'm
see
definitely
like,
going to
yeah,
look at that because that's absolutely mind blowing. I mean, talk about
yeah,
a situation where conventional medicine has very little to offer those people.
yeah.
Yeah.
So we see a lot of autoimmune things, and then joints. I mean, that's just kind of everybody seems to have a bad knee or a bad shoulder. And I've got the before and afters of my knee. Like, again, I was the first one. My knees hurt. I've always had knee issues. We did my left knee, and then a couple weeks after, I'm like, oh, why does my right knee hurt so much? And then we went and did the MRI, and I had like multiple meniscal tears. I had a torn ACL. Just my knee was pretty bad. And so I did treatment, and then 9 months later did a follow-up MRI, and I've got a new knee. Like it completely regenerated. So you can see the before and after posted there, and we've done that for a lot of people. So we do a lot of elbows, hips, knees. We're doing a lot of backs now too. Like I think we were talking about earlier, we use with herniated discs, we'll put ozone into the disc in the operating room with the big C-arm X-ray. We've got this great orthopedic surgeon that used to work with the Miami Dolphins and then with the Barcelona soccer team. And he goes in there, does that, and then puts stem cells into the disc. The ozone kind of shrinks it, stem cells build it back. And we're seeing really great results with that. Otherwise they usually offer like a fusion or some other surgery that usually doesn't leave you with full mobility and usually some pain. So it's a pretty easy way to go.
Wow, it's absolutely fascinating. So my audience is primarily interested in the resolution of chronic pain, and
Mhm.
we focus primarily on the most common causes of chronic pain. The most common worldwide is back pain, like you just mentioned, followed by neck, followed by various joint pains throughout the body. So what could a person who had, say, severe degeneration with herniated discs potentially accomplish via a mesenchymal stem cell treatment?
Well, it depends how bad it is, and we see some pretty bad cases. But like I personally just starting to have a compression at L4, L5, horrible sciatic nerve pain. Like I always thought people were big babies that complained about back pain until it happened to me,
Mhm.
and it felt like someone had a cattle rod to my femur. And I didn't do the ozone treatment. I just did intramuscular and 100 million IV 2 years ago, and it was probably 2 weeks after, and the nerve pain was gone.
Wow.
The stem for the back, it's usually the nerve pain's the biggest thing. The stem cells send out what are called neurotrophic factors that essentially guide the neurons to regenerate nerves. So with neuropathy across the board, we're just seeing incredible results with pain relief with nerve pain, which I mean, that's really the worst kind of pain in most cases. So just
Absolutely.
getting the cells in there for the nerve pain. In my case, it basically rerouted that around the herniation. Like it was barely herniated, it was like more of a bulge. So that's what we can do if it's not too bad. When it's really severe, well, the best case is usually to go in with the to each disc individually. Most people have more than one. And we go in with the ozone that essentially shrinks the disc. I think of it like an ice cream sandwich, right? It's being pushed, kind of squirting out, pushing on the spinal cord. And by injecting the ozone in, we're able to shrink it back down, get rid of some of that herniation. But now you're left with some stenosis, right? Because the disc is smaller. So since we already have the needle in there, we then put 25 million stem cells, trying to rehydrate it and slowly regenerate that tissue to build it back up. And we're seeing success with that. So that's what we're doing.
So you guys have before and after images of spines where you're actually showing increases in disc height.
Yeah, yeah. If you go to our site, you can see one of the first guys who did it. I mean, he's, I think, early 50s, and he's doing like wind sprints up hills in Arizona in like 110-degree heat. Like he was doing that like 2 months after treatment. Wait, too
Wow.
soon. We don't like to see people going that soon after, but he got after it. So it's really helping a lot of people. Yeah.
That's absolutely fascinating. I have another question. If a person has had, say, a prolonged sciatic problem where the nerve has been compressed for months or years, and there's actually neural damage where you're getting end organs or muscles that are not functioning properly, can you recover some of the functionality to the organs that are supplied by the nerve?
Um, So not that which like I guess with organs we typically see pretty good regeneration. We've seen even patients with stage 1 kidney failure get out of kidney failure just from IVs.
Wow.
And we're going to start, I actually was talking with the anesthesiologist this morning. We're going to start doing direct kidney injections with an internist we work with here.
Mhm.
So we will, that's much more effective even than the IVs for that. Anytime you can go direct to an organ is better, but then we got to put you under and it becomes difficult. So really kidneys will be where we start with that. Then we might work on some others in the future. But yeah, with the nerves, we're seeing it help. I can't think of any case we've had where it was like directly a organ was related to a nerve that it then repaired, but we're seeing nerve damage. I
What
mean,
if,
really incredible results.
what if I said target tissue? So a person with severe sciatica whose calf stops working and just because of the nerve supply is interrupted, and it's been interrupted for so long that the nerve is not going to regenerate itself without intervention. Can you guys recover that type of functionality?
I don't know. I haven't had anybody that severe, so I'd love to tell you yes, but it's like any medical treatment. We
Sure.
can tell you all the great stories about it, but there's always going to be some cases that don't work. Even with stem cells, some people won't react. But we've like one patient we had, she had a amputated leg
Mhm.
and really bad phantom nerve pain. So we did an IV and we injected basically to the stub there, and she's got a great testimony on our site. Like it fixed the phantom nerve pain. It healed the nerve damage there.
Wow.
Um, probably the most severe we've seen was a guy like pretty close to you, he's in Long Beach. I don't know how he did this. There's some homeopathic remedy where people take like a little bit of hydrogen peroxide and put it in water and drink it. This guy drank a whole glass of hydrogen peroxide.
Oh my
Like,
God.
yeah, his nervous system like completely fried. It was neuropathy head to toe. His hands were like, it was like 100 degrees out here. They were like ice cold.
Wow.
It really messed up everything. And we've been able to get him like nearly pain free. First with an IV, then we had to go direct to his feet because that's where most of the pain, was left. And he's like, and he's barely got any pain at this point. So we've
Wow.
seen some pretty severe nerve damage recover. But yeah,
That's
that's right. Yeah, so it does help with nerve damage.
That's amazing. And what about a situation like a knee? So earlier you said that my original idea about stem cells taking on the flavor of, say, cartilage in a worn down knee is not really the case. And instead we should think of them like foremen at a construction site. So how does that exactly work? Say we have
Yeah.
a 50-year-old person who's got a severe tear in their medial meniscus. And what can a person like that expect from a mesenchymal stem cell treatment?
Okay, so they should be able to, softer tissues like meniscus repair very great. Like as long as it's not completely torn, they're not magic. They can't like reattach, completely torn things. But yeah, no, we've seen severely torn meniscus heal up. Meniscus, tendons, ligaments, usually pretty easy. Cartilage gets tougher. Like we'll see fourth degree osteoarthritis, people be like, oh, it's bone on bone. And they're usually looking at an X-ray. It's pretty rare I see an MRI. So we do an MRI with all our treatments. And as long as there's even a little bit of cartilage there left to build on, we can build on it. And we typically see fourth degree get to like second degree within like 6 months.
Wow.
We've seen some patients get pretty much like, near probably like first degree, pretty close to there from like a follow-up treatment 6 months after. We had one lady do that did the MRIs to kind of follow up. But that's what we see there. Then with meniscus, the reason it can do that is the way that they heal. So, or really, let's think about our bodies. So the reason we don't heal so well as we get older is when we hit bone maturity, usually around 21 for men, 18 for women, we lose 90% of our capillaries.
Mhm.
Well, that's where the parasites live, on the capillaries. Those are your mesenchymal stem cells. So you lose about 90% of that at bone maturity. And when they come off, they look for inflammation. They don't always find a capillary to call home again. So we're steadily on the decline of what we have naturally. And the problem is with that meniscus, when you get older, like my meniscus, I injured it and the white blood cells rush there and they can only heal via fibrosis. Good patch up job, but it's like pouring cement on the area and not like finishing it or anything. You typically create a bad foundation that can't be built back upon. Like I'd been on growth hormone for years before I did the stem cells to fix my knee, and it kept it from getting worse, but it couldn't get past that scar tissue.
Mhm.
So the first thing and the most important we're seeing is that the mesenchymal stem cells seem to be able to guide the removal of scar tissue and then guide the cells and the growth factors and everything else to heal that tissue. So the scar tissue is really the biggest thing. And I really think that's why we're seeing so much success with it, is getting rid of that scar tissue really allows the body to heal.
Very interesting. And so what's involved in a standard treatment, say for a knee, if somebody were to come down to Puerto Vallarta, what would they expect coming in?
Yeah, it's a 5-day trip. You fly in, the first day just rest up. The next day we do a full blood panel, kind of just looking over everything, making sure people are good. We do an MRI. It's just for the patient's safety and just for liability, all of that. We had one patient one time, we found a tumor in his knee. I mean, it was completely random, who'd have thought, but we're like, yeah, you need to go take care of that first. We don't want to I mean, the stem cells, from our understanding and what we see, we don't think they'd make cancer worse, but like, we're not trying to be a cancer clinic anyway. It's not the right fit for these kind of stem cells. So we look for that. And then day 3, we review. We usually get those results like later that evening. We can look at them like on day 4, and then we do treatment, and it's a really quick injection. I mean, it takes almost no time at all. It's you go in, it's anticlimactic for most people. They're with all this pain, they come in, a quick injection, like that's it. You're like, oh well, like just give it about 2.5, 3 months, you'll see. And yeah, they see. So
Amazing. So you guys are doing, you guys have MRI in-house, or you're associated with a clinic down there that has an MRI?
yeah, we work with a lab. They have a brand new GE 1.5 Tesla machine that we use, and we just kind of have it all packaged together. So anyone who does a joint, if they either need to bring their own MRI or we do an MRI here, and that way we know exactly what's going on, and so that they can have a before and after. The tough part is most people don't want to sit in that tube, so I don't have as many after MRIs as I wish I had.
Sure.
Got tons of patients that will tell you how good they're feeling, but most of them don't want to jump back in a tube, and they cost a lot more up in the US than they do here. So most people are like, hey, I'm healed, I don't want to spend that money. It does make it tough to collect the data, but we can go off the anecdotal. People will tell you if they hurt.
Yeah, I can appreciate that. Speaking of people hurting, a lot of times here in the US, stem cell treatments are being pushed as a pain killing treatment. And like I had mentioned to you in one of our previous conversations, I almost felt like that was a disservice to the stem cells in terms of they're doing so much more than just killing pain. And I wonder if you could speak to that.
No, that's a great point, because yeah, I wouldn't look at it. It's probably one of the most common questions I get, like, oh, well, when am I going to have to come back for another treatment?
Mhm.
I did my knee 5 years ago, and I'm out playing. I mean, you can see if you look at like my Instagram, I'm out playing tennis, I'm riding dirt bikes, like not easy things on the knees,
Mhm.
and no issues. So it's because, like we explained, you're getting rid of that scar tissue, and then you're creating cellular regeneration. You're fixing the underlying issue again, healing like you did when you're a little kid. So if you fix medicine today, for a lot of things, it's like that. Give a pill just to cover up what's going on. They never seem to go after what's actually causing it. And that's what the stem cells do. They're targeted to inflammation, but they don't stop there. They then fix what's causing that inflammation. So yes, it can eliminate the pain, but not in the sense that like you don't have to worry about it coming back unless you go hurt yourself again.
Mhm. But the purpose of a stem cell treatment is not to eliminate pain. The purpose is to repair and regenerate underlying damaged tissue. And then the pain killing effect is almost thought of as like a side effect. Isn't that an accurate way of saying it?
I think I mean, people usually don't contact us unless they're in pain. They're
Sure.
looking for a solution. So
Sure. Yeah. Yeah. I
yeah,
mean, the symptoms let them know that there is the damaged tissue, but the actual purpose of the treatment is to repair the damage, correct?
that is correct. Yes,
Okay.
completely.
Yeah, it's a very interesting process. What's involved in the rehabilitation once a person comes in and has this anticlimactic injection?
Yeah. So we tell them 3 weeks, just take it easy. You can walk around normal day to day, but no gym, no like sports, anything. And then we have a sort of like a light exercise rehab program. It takes about a month. So really it's about like, 1.5, 2 months post treatment. Most people can get back to their old routine, whether that be going to the gym, whatnot. I took 3 months off of doing legs at the gym. That was what I did. And most people tend to take it pretty easy, but usually about 2 months post treatment, you can kind of get back out there. We get a lot of people that play sports and different things, and they get out there sooner than they should, but it still heals because again, you're creating inflammation that the stem cells are targeted to. So as long as you don't push it too hard and injure yourself, like you can get back out there pretty quick.
Wow, fascinating. And the injections themselves, you saying that the mesenchymal stem cells that you're injecting number in the millions for most of your standard treatments.
Yeah, I don't think, yeah, every single one of them's in the millions. Yeah. The knees, elbows, and ankles, 25 million. Hips, shoulders, we do 50 million. There's just more space. Wrists, 25 million. Fingers, 25 million. But yeah, it depends, because you can only fit about 25 million per milliliter of solution. We use sodium lactate to suspend it in. When you start going at a higher concentration, it seems to kind of kill the cells. Like 25 million is about the max you can fit per milliliter. So yeah.
Wow, that's really interesting. And the injections themselves, are they fluoroscopically guided to match up with where the damage shows on the MRI, or how are you guys doing
No.
that?
That's kind of, I mean, we use an ultrasound, but as you know, the ultrasound doesn't show too much. It's really I'd say we probably do it mainly because a lot of these clinics in the US, it's kind of a marketing gimmick. They're like, yeah, it's all ultrasound guided. You know, like the doctor knows where the joint is. They can inject it pretty simple, but it makes people feel more comfortable. So we do it. But the fluoroscopic's not needed because these will target inflammation. Like a good example is my brother. He's a firefighter in Las Vegas. He came to us many years ago because he has really flat feet. He has a lot of feet issues. So we did his ankle. And it was about 2, 3 months after he calls me up. He's like, man, you fixed my plantar fasciitis. And I'm like, you didn't even tell me you had plantar. I mean, like, so it went from the ankle all the way down to the bottom of the foot. They can travel a long ways. So obviously we do the MRI and we want to get it as close as possible. But when we're doing the knee, I mean, you only have 2 entry points and it's a big hollow cavity. So you just get it in there. With shoulders, we get a little more. Usually we go kind of from back here to get to the joint. But, you know, if it's a labrum or if it's a rotator cuff, we'll do 25 here and 25 up here. So we get it as close as we can, but that's the cool part. You don't have to hit it specific. These clinics in the US have to hit it specific because they're using so few cells that if they don't get it precisely there, they don't have a chance.
Wow.
Like there's just not enough cells to get there. So that's really what it comes down to.
Very interesting. I want to ask, who's your ideal patient?
Ooh, well, for what treatment? I mean, it's kind of tough because we have so many treatments.
Sure.
It sounds too good to be true. It sounds like, oh, this works for everything, but it doesn't. Autoimmune, joints, certain chronic degenerative issues. But most of our patients in general, I'd say, are probably over 50 to 70 and just have some nagging pain that they're kind of out of options. We tend to attract more kind of freedom-minded people that like aren't so, I don't know if you'd say trusting or how you want to put it, but we get some pretty good, interesting, like talks with people that seem to be a little bit more open about what's available outside of the United States. Like they're not afraid to see what else is out there, and that seems to be more of what we attract.
So 50 plus, autoimmune conditions, various joint conditions, chronic pain conditions. Who's not a good candidate for stem cell treatments? The type that you do.
I'm not sure in that. People that we get a lot of people that come even just for IVs, just for the anti-aging benefits and stuff. So there's usually a fit for anyone, but at the same time, like there's certain cases, like we'll see some people with COPD, for example. We see a lot of lung conditions, and when they get too far, it's not worth it. You're just like, you know what, like it's going to be harder on your body to get here than it is to actually do treatment. So that can be one. I wish it worked for Lou Gehrig's disease because that's what my dad had, but we just not really seeing. It's weird. We had a patient, he was just here last week with PLS, and it's worked amazing for him. Like the guy's walking now, and he was in a wheelchair when he came last year. But there's just certain diseases like that, or Parkinson's. People really want this to work for Parkinson's, and it doesn't seem to work there. So there's certain ones where you think, oh, this could maybe be the thing there. Not quite the fit. So yeah.
What about people that are post-surgical that have had, say, a bad experience with surgery and they've been left in worse shape? Do you work with people like that?
Oh yeah, we get a lot of that actually. Yeah. Again, it's the scar tissue in most cases. So it's a case by case basis, but we see a lot of people that do that. We have one guy, for example, and people can talk to him on our website. We have a hotels section. He's one of our patients. It's a nonprofit kind of tour, like hotel booking kind of service. And his bicep, they had to literally like take, I think, a tendon and drill a hole through the bone and reattach it there. And he still had a ton of pain, just wasn't healing. He'd come to us for knees first, and we treated that, and he's basically pain-free now. So we are seeing a lot of people that had surgeries that didn't go quite the way they wanted, and we are finding the stem cells work. But if it's a metal plate, things like that, that's usually where I tell people, hey, it's most likely if it's a plate or something physically in there, like there's not always a good chance that that's going to do it. If it's scar tissue based, we usually can fix it.
Oh, that's amazing. It seems like stem cells are a fantastic option for a lot of people that don't have a lot of other options.
Yeah, it really is. I mean, and that's, I guess that's probably maybe our key person. They've exhausted the options, or a lot of people that don't want to get surgery. They're like, there's got to be a better way, and that they end up finding us.
Very interesting. Last thing, where do you see stem cells going in the future as they continue to be used more and we find out more about them? Where do you see this heading?
I see some cool stuff, and we're trying to be on top of that. So I'll just tell you the direction we're going, because I think we're going to be the first to do it. But I was up in the States about 2 months ago and met with a lab up there, and they can't do it there because of the cultivation, but they can send those cells to me and we can do it here. So I'm working with the lab. We'll probably start doing, primary round stuff with this, but they're basically turning the MSCs into mesenchymal stem cells, they called MSCs a lot, into neurons that are immune privileged, so they're not going to be rejected. What else was it? There was dermal papillae for hair regeneration.
Wow.
We're looking in there, and they're already making these things, but we're going to start kind of rolling that out. And there's a few others, but there's certain, oh, that was it, chondrocytes, because like we had talked about with the cartilage.
Yeah.
So they're also making chondrocytes, which they'll be able to put directly in to regenerate cartilage. So we
So
will be able to physically grow you new cartilage this way. So
that's what I was talking about when we got into this conversation initially, is you actually see it getting to that place where you can regenerate specific tissues.
yeah, and I mean, my wife did like a year of med school here. She was thinking about going becoming a doctor, and we just got too busy and she couldn't keep going. And she scrubbed in on a lot. It's pretty cool. Mexico medicine, like first year students are like scrubbing in, helping and stuff. Like it's pretty incredible. Like it's hands on from the get go. But one of the conferences was a doctor from Guadalajara doing this very thing, as they were creating the chondrocytes and actually doing a surgery and putting them in. We believe from what the lab we're talking with has been doing is we'll just be able to go in with the needle and get it right to the area, so we'll be working on that. I mean, it's going to take a little bit of time, but those are things that I think within the next couple of years will be available.
Wow.
Further out would be what's called induced pluripotent stem cells. There was a Japanese scientist that he won the Nobel Prize a couple of years ago for turning skin cells into pluripotent stem cells, which that's like what the embryonic stem cells are. I mean, it can turn into whatever cell you need them to. So they just did their first, instead of the guy getting a heart transplant, they created cardiac cells and implanted them, and it was a success. So as time goes on, they'll be able to get more specific with the tissues and cells that they can generate and then put them where they're needed. I think that will take longer simply because of all the, trials, everything else that they're going to be doing. So we'll see how it plays out, but that's where they're at.
That's absolutely, I mean, what an exciting time to be in medicine. That's like pure Star Trek stuff where you go in and repair stuff, where amazing.
Yeah. So I mean, it's getting closer and closer. It's pretty exciting to watch.
Yeah, fantastic. Where can people find you and find out more information about the Dream Body Clinic?
Yes, so it's just www.dreambody.clinic. That's the site. It's got all the information there. People can give us a call. We got a toll-free number that they can call anytime, and you'll get to talk with someone here, talk with the doctors, and it's all free. We, consultations and all that. That's just what we do.
That's fantastic. And we'll include a link for those before and afters in the description for this video. That's awesome. I know people are going to love to see that. And I have a request, because I'm going to be down in your neck of the woods later this year, and I'd love to come down and check out the clinic firsthand.
That'd be amazing. Nothing we'd like more.
Awesome. Thank you so much, Josh. I really appreciate you taking the time and for the important work that you're doing.
Thank you so much. We'll talk here soon. We'll see you soon.
Sounds good. See you then.
All right.
Thank you so much for watching. I really hope that you enjoyed this video and that you'll put the information to good use. For more information about what Joshua and his team are doing down at the Dream Body Clinic, check the link in the description down below. You're also going to find down there a couple of links with a full series of MRIs, both before and after, so that you can see for yourself what's possible using stem cell treatments. Make sure to like this video, comment down below, and subscribe to the channel to stay updated on the new videos that come out each week. That's all for now. See you next time.